Hey, so in today's video I want to help you understand the why ribcage mobility is actually going to be important and influence the glenohumeral joint mobility. So if you have any tricky shoulder cases where you're struggling to increase the range, then it may be worth watching this video to increase the ribcage mobility and then finally get long-lasting changes. And as always, don't forget to subscribe to our channel. You can be part of the online community where we'll give you first look access to all future content. And if you don't know me, my name is Dave O'Sullivan. I've been very fortunate to work with professional sports teams over the last 13 years, as well as run my own private practice. And we use a pro sport approach also in private practice with non-sporting patients. So everything I'm going to share with you here, we also implement in our own private practice. So you may have seen our diaphragm PDF where we talk about this stretch here. Now, I was first introduced this concept through Ron Haruskin, the Posture Restoration Institute. They really opened my eyes to the importance of that. And in this diaphragm PDF, we cover this test. Okay, so again, I'll do a separate video for the hip joint. But in this test, basically, what we're going to do is we are going to, so if I just come into my mentorship, just a quick clip of this. Okay, so again, we're just testing the HGIR or glenohumeral internal rotation. Okay, so very often what we'll find is that will be decreased. Okay, so they might have something range of about here, or they might get pain and something like that. So again, as a part of a comprehensive approach, you may find, okay, one of my key things that I'm going to focus on is improving this range of motion, and then obviously start to maybe focus on strength or increasing the load tolerances, as we would say, as opposed to the pre-step before strength. So why does ribcage mobility help this? Now, this is the big question, and this is why we need to understand this. Okay, there's a useful article here, the value blown up a balloon. Again, full disclaimer, I don't treat using a PRI approach, but I find some of their concepts useful, where we can take some of the key concepts and implement it into your own step-by-step system. So when we have a quick look at the literature, we can see that actually when we elevate the upper limb, there is movement of the ribs. Okay, and again, especially the most movement happens around the fifth rib. Okay, so the fifth, the fourth, the third ribs, here you can see that there's quite a bit of movement. And then obviously as we elevate the arm, the lower ribs move less and less and less. Okay, so for me, clinically, this test here is a useful key performance indicator in terms of establishing, also cross-referencing, upper ribcage mobility. Okay, so again, the likes of PRI and a few other people might use this stuff, and they'll use other tests and assessments, and they'll talk about airflow and all that. For me, we can just use this as a quick and dirty test to assess also ribcage mobility. Okay, so again, when we lift the hand overhead, we can see ribs 5, 4, 3, and to a point 2 as well, a little bit, getting that movement. Okay, and that's going to be very, very important. And then also we can see down below that also when we move that thoracic rib cage, okay, that we have these reactions through the pelvis again. So in the diaphragm PDF, again, we talk about the hip flexion test, which I will do in a separate video. Okay, so again, nothing major here. Again, in this study, they show that when you lift the one hand up, we get these movements of the rib cage. So ribcage mobility, it's a part of this process. But the big thing I want to go in this video now is, why does ribcage mobility improve this? Well, if we have a quick look at our movements, okay, special thanks to Muscle Emotion for permission to share this videos. Okay, so again, what I want you to look at here is just a simple stretch. Okay, so again, I want you to start looking at the reactions throughout the whole body. Okay, so again, this video here, you might just see a pec stretch, but what I want you to focus on is the amount of movement of the rib cage, the clavicle, and everything else that has to help the shoulder in this position. So you might look at this as a pec stretch. I look at this as an apprehension test. Okay, so again, I see an apprehension test there. I see a player who comes into me and we do an apprehension test. Oh, I don't like that, or I don't feel great with that. Okay, so again, I want you to look at the tissues involved, the joints involved in actually getting the player or the patient in your clinic into this position. So it's not just a case of we're testing the labrum here, we're also testing a lot of other things, or I should say a lot of other things need to happen in order for this thing to be successful. You could say another way, if I don't have an ability of that rib cage to protract and come forward, okay, am I winding up this shoulder in end range a little bit earlier? Okay, and logically that would make sense to me that would happen. Okay, so there's a few things I want you to notice here. I want you to notice the rib movement. Okay, so again, we're getting depression, retraction, we're getting protraction, and a bit of elevation of these anterior ribs as we obviously stretch clavicular fibers of pec major and sternocostal fibers of pec major here, as well as anterior deltoid. Okay, so you can see when we ER the shoulder, okay, that's coupling with the rib cage protracting, elevating. Okay, so and again, we've seen that here in this literature that the ribs start to move. That's absolutely fine. And again, we can also see that's not just that, but there's also other things happening in the rest of the body. Okay, so keeping it very simple at the moment. Okay, so now back to our original question: why does mobilizing the ribs help IR? Okay, well, if we go back to this video and we have a look at the opposite reaction, so when I IR or internally rotate the glenohumeral joint, you can see there's a coupling. Okay, now again, in this video, obviously it doesn't completely IR, but I want you to get the concepts here. So you can see that IR is coupling as that shoulder, that glenohumeral joint is on its way back down to internal rotation. Okay, so again, ER, we're going to have that rib cage protracting. IR, we're going to have that rib cage depressing. Okay, so now what I want you to think about is, why wouldn't that rib cage want, or the upper rib cage specifically, want to depress? Okay, and then when we go back to the research, it gets interesting when we look, okay, well, what is attaching to these ribs that could potentially influence that movement? Okay, so very often what we'll do in the clinic is we'll give them a passive rib cage mobility. So we'll depress the rib cage, retract it, then we'll get the patient to hold that position. Okay, or you can do that through a prolonged exhalation and then retest the HGIR. Now, if that improves it, that's great. Okay, and again, you know, I appreciate other people will talk about airflow and all that stuff. For me, I just keep it simple. Okay, again, I don't think we need to, or certainly I don't feel I need to go into that level of things, but we have to appreciate that, yeah, there is all of these other things going on as well. It's not just the muscles. Okay, but if the more simple we keep this, the more clarity we're going to have. Okay, so what we're going to be focusing on here is, if we can depress that rib cage, okay, then we're setting that glenohumeral joint up for success with HGIR. Okay, so then the next question, okay, is what could potentially influence that? Okay, so the serratus anterior. Okay, so if I go into muscle emotions, serratus anterior, some lovely videos here. Again, I'm not going to show you all the videos. Okay, again, we can see that serratus is going to attach around that fifth rib. Okay, and what I really want you to see, okay, in this position here, is that protraction of the rib cage. Okay, so look at how much that serratus anterior has to lengthen, okay, lengthen in order to facilitate, okay, that good position here. Okay, so if someone has an apprehension test, I might be focusing some soft tissue work or some stretches or whatever you want to do to facilitate, to help that lengthening or regain the lengthening of the serratus anterior to facilitate that rib cage protraction. Okay, so again, a lot of people think, oh, you know, it's just about blowing balloons up and it's about depressing the rib cage. That's couldn't be further from the truth. The approach in the Go-To Physio mentorship that we want is, we just want this rib cage to be able to protract, and we want it to retract, because it's so important that that rib cage can protract as well. Okay, and I've got absolutely no issues with that rib cage going this way. Okay, in fact, a lot of my my patients, I'm actually facilitating this. Okay, I'm helping them get more of this. Okay, as opposed to just always trying to get the rib cage to depress. Okay, so again, it goes back to understanding the why. Okay, so serratus anterior is going to be important there. I want you to notice that the importance of that retraction there. Okay, so there's a big lengthening of those tissues happening. Okay, then we get to other ribs around the fifth. You can see that pec minor as well. Okay, again, I don't want to make this all about the diaphragm. Okay, the diaphragm's a piece of the puzzle, just like everything else. Okay, but that diaphragm needs to stretch in order to get that rib cage depression. But we also need the pec minor to lengthen. Okay, so again, that's going to be another tissue that you might be interested in. Other tissues that attach around that fifth. Again, the rectus abdominis, that's going to be attaching there as well as the obliques as well. Okay, so again, the obliques and the rectus from a stabilizing point of view as well, potentially, as that hand goes overhead. Okay, so again, some very, very interesting stuff there. Okay, and then the final bus I want to talk about is the scalene. So again, I want you to look at especially the posterior scalenes attaching to the second rib. Okay, and the scalenes attaching to the first rib. So you can see again, for someone who's maybe stressed, who's increased their breathing rate, etc. Okay, they're going to be using their accessory muscles a little bit more. Okay, so again, if we're not, you know, relaxed and we're not taking that diaphragm through full range of motion, we're using our accessory muscles a little bit more, could that potentially be contributing to that stiffness of the rib cage? So you can see when I depress that rib cage, what I'm really doing here is I'm stretching these scalenes, or I'm allowing these scalenes to lengthen. Okay, so again, when I depress the rib cage and then we recheck IR, okay, and IR would approve, okay, what we're also doing is we're lengthening these scalenes. Okay, so again, one of my approaches, okay, would be, rather than just always doing maybe breathing exercises for a shoulder that when we depress and we facilitate that rib cage depression, it improves the internal rotation, might be to do some either hands-on treatment here, stretches, or whatever you want to do here to take the tone down in these tissues here. So again, when we allow these tissues to lengthen again, you can see we get that nice internal rotation of the rib cage, which is essentially what we want to facilitate that IR. Okay, so again, there's plenty of things here. So as that rib cage goes down, okay, the scalenes here distally are going to require to lengthen as well around that first and second rib. Okay, so again, we just want to facilitate any of the tissues here to allow them to go through a range of motion. And as always, at the go-to physio, we want to see, okay, what is in their story that could potentially be influencing the inability of that rib cage to go through full range of motion. So just like a knee joint, if you have a sore knee and you've got restricted flexion or extension, you're going to go after maybe the capsule, you're going to go after some of the muscles to facilitate the ability to get back a full range of motion. And that's the exact same thing that we want to do here with the rib cage, is we just want to facilitate the ability of that rib cage to go through a full range of motion as part of the treatment process. Okay, so again, we don't have to get too carried away with what's going on. We can clinically reason why we're doing this stuff. And then a big thing as well is that ultimately when we do all of this stuff, okay, is we're helping that person, you know, not only help their pain experience, but we're helping them get back into rest and digest as well. So again, it's the interaction between the respiratory system, the neurology, and the musculoskeletal system in the real world that we have to take into consideration. That it's not just about doing this stretch to the muscle caused your shoulder to feel better. Okay, there's a whole lot of things. So prolonging the exhalation and restoring nasal breathing, you can see here in this study, that was able to decrease the tone of a lot of the accessory breathing muscles. Okay, so again, when we change that nasal breathing or to nasal breathing, okay, again, what we're doing is we're just facilitating the ability to get back into rest and digest. Okay, and again, there's some studies here that when we stretch the diaphragm, we increase the neck range of motion. Okay, again, among a few other things. Okay, so again, for me, what I want you to do here is I want you to understand why some of this stuff might be happening, as opposed to maybe getting too carried away and putting the diaphragm or putting the pelvic floor on a pedestal and thinking, oh my God, you know, the diaphragm, it's going to be the be all and end all. That couldn't be further from the truth. All that we're doing here is we're facilitating the diaphragm to lengthen. We're helping the rib cage to depress. So again, for me, if I just done breathing exercises here, but maybe there was some protective guarding or tone around the scalenes and the scalenes weren't able to lengthen, then what you're probably going to see is you're probably going to see short-term changes. Okay, so if you do some stuff with the diaphragm stretching with this study, but that person has got a lot of issues, they might have a disc issue at the neck, etc., among many other things, okay, and you're not maybe focusing on why the scalenes have maybe higher tone, okay, then potentially you're not going to get that lasting change. So that's where the importance for me is looking at the person in front of us, what's in their injury history, what's in their story. Similar, if you do this diaphragm stretch, but every time that person goes back into the real world and they've got high stress, a lack of sleep, among many other factors that we know contributes to pain experience. Okay, if you're not addressing some of those things, you know, is doing 2 to 3 sets of a scalene stretch or a diaphragm stretch realistically going to get long-lasting changes, and that's where we have to build that graded exposure. Okay, so I hope this is making sense so far. If it's making sense so far, just pop a yes into the comments along with your biggest takeaways so far. Okay, so again, just gather your thoughts at this point in the video. What have I said so far that you can take, the good bits you can take and implement into your step-by-step system. Okay, and as always, I want to recognize Muscle Emotion for giving me permission to use their software. It makes my teaching and the mentorship so much easier. I'm a massive fan of this. Again, you don't have to be looking just at the movement. We can, like I've done here, like a pec stretch, we can facilitate it. We can look at the whole body to appreciate. So I think this is a really, really useful software. For me, when I'm trying to make sense of particular symptoms, it's probably the first thing I go to this and my cadaver book as well. Okay, so again, if you want a discount on this, Much have kindly given me a discount code PSP20, and that'll get you 20% off this software if you're interested in that. Okay, but the key thing here now is, as I said, we look at the whole person. So it's not just about getting the scalenes to lengthen to facilitate that HGIR. It's finding out what are maybe the true stresses specific to this person that's causing the scalenes, or that's causing the pec minor, that's causing the serratus anterior to maybe have some kind of guarding, that's having an inability of those tissues to go through a full range of motion, which is in turn then restricting the ability of that rib cage to go through full protraction and depression. And that's where really we need to understand the person's story. Okay, and then when you do these exercises, okay, if you do your interventions for the patient, always retest your KPIs. So again, you know, from here we've got a variety of different KPIs you could be using, but again, it's so important to understand that. And the key thing I want you to understand here with the ribcage mobility and restoring this ability of the ribcage, okay, just because you change the HGIR in real life, and that's great, or you take away that person's apprehension, okay, when you do an apprehension test, and maybe you do that through facilitating these tissues, or doing some soft tissue work through hair or whatever, and you decrease that apprehension, it's critical to understand that you've basically just facilitated them to tolerate that level of loading, okay? Whereas in real life, especially in my world, in professional rugby union, rugby league, etc., this is where we need them to be able to tolerate the loads, okay? Or if it's a person in the real world that is maybe stressed, they've got prolonged stress, okay, in their lives, and again, you might facilitate them to nasal breathe, okay? It's not about them being able to nasal breathe in the physio room, it's about them being able to maintain that somewhat homeostatic state, or not go too far into fight or flight in the environments that are going to stress them, okay? So again, we got physical and what I call emotional stressors, okay? Can we thrive with the emotional stresses in the environment? So that's where their environments is going to be important as well, okay? But for me, how this approach sits is, let's get the ribcage mobility, okay? So let's restore that ribcage mobility. Again, do we need to look at the scales? Do we need to look at the serratus anterior? Do we need to look at some of these tissues? Okay, it all depends on the person in front of us and making sense of that subjective, and then linking that to the objective. But then what we need to do is, once we have that, is we need to go through the graded exposure program. So we need to get that load tolerance all the way through step by step, and we need to bridge that gap from the low level rehab to the high level rehab. We need to bridge the gap from the low level breathing exercises to being able to maintain or not go too far into fight or flight in an environment, in a potentially stressful environment for the patient. Okay, so again, that's where we cannot just rely on one exercise, or we cannot rely on one hands-on treatment. You need to be able to piece the puzzle, and that's where we need the A pillars of the go-to therapist, or the go-to physio A pillars. Okay, so again, this is what we teach in the mentorship. It's not just about hands-on techniques. It's not just about a rehab exercise, because the most dangerous number in business and the most dangerous number in physiotherapy is only having one exercise or having one treatment technique. And that's where you have to understand the why, or be able to clinically reason what you're trying to do. And then it doesn't become about the exercise, it becomes about that exercise or that hands-on treatment solving a problem. Okay, so I hope that makes sense. Okay, so for the next steps, if you want to understand more about this stuff, and if you want to get access to my shoulder return to play course, that'll take you through the graded exposure all the way through. For a limited time, you can access my shoulder return to play course for 14 days. And included in that is also the manual. So when you come onto this page, you can click here, and that will give you access. You'll also get access to my 53-page manual. Again, I put some more studies and links in here for you as well, and about the approach that we're trying to get with these stubborn cases that have maybe failed traditional approaches. Okay, so you can get access to that. You get access to some of my best exercises, and again, most importantly, you can start to build your step-by-step approach as well. Okay, so if you want that, all you have to do is head over to thegotophysio.com/free, and you can have 14 days access to that as well. Okay, so I hope you enjoyed this this video. If you want more videos like this, then don't forget, post your biggest takeaways in the comments below, along with what other pieces of content you want more of, and I'll be sure to put them to my list and get them for you. Okay, so thanks for watching, and I'll see you soon on the next video.